20 minutes before 8 here on Morning Live. Thanks so much for staying with us. And now, last week, we reported on police suicides. We even had one of our questions of the day focus on this. And today, we continue this discussion. And since Parliament's Portfolio Committee on Police raised concern about the high number of police suicides earlier this year, even more cases have sadly been reported. And just last week, an officer murdered his wife and then turned the gun on himself in full view of people at a police station in Hout Bay, Cape Town. And unions are insisting that the rate of these incidents will only decrease once employee assistance programs are improved and when psychological debriefing becomes mandatory in the service. So to discuss this further, we're joined by Mpho Kwinika, who is president of the South African Police Union, and he joins us via telephone. Mpho, good morning to you. And also with us, Bragadier Petunia Lenono from the South African Police Service. Welcome to you as well.
Thank you.
Good morning.
Let me first start with you, Brigadier, just, by sketching a picture for us of how prevalent these incidents of police suicides actually are.
Yeah, thank you so much for having me this morning. I think that police suicides is one of the biggest challenges that the organization is still facing. We, on a 3-year basis, we conduct an analysis to determine if the stats have decreased or have they increased, and we have found that in the past 3 years it has sort of like remained constant. But we are still worried because for us as an organization, one police suicide is one too many. It means that the community are losing one police member who could be serving them and protecting them. So until we really get to the point where we can report a nil return on suicides in a financial year, then I would say that we are really moving somewhere as an organization.
If you could just give us a sense of the numbers, what are we talking about per annum or per 3-year cycle?
Now, I would say that currently the number is more or less constant, and what you see in the community is exactly what you see also in the organization. So what happens in the organization is proportional to what you see in the communities.
But do we not have numbers in this regard?
The numbers, I can just say that they are constant, and we are fighting to decrease them.
But you see, for me, that is problematic because when it comes to reporting suicide and just capturing, how people die. For example, if you look at a country like Canada, they are able to tell you that in a certain age group, suicide is the second largest killer of people in a certain age group. Are we able to give statistics in that way when it comes to suicide?
Within the South African Police Service, we have seen that most of the prevalence of suicides are with your constables, your sergeants, as well as your warrant officers. So our lower ranking police officials are the ones that are mostly at high risk of committing suicide.
Let me bring Mpho in. Mpho, as far as you know, are you aware whether it is actually the conditions that police find themselves working under that leads to these suicides or not? How much research has been done into this?
I took note of what you said, especially in relation to the country, Canada. We have got exchange programs with the police in Canada and at the university there, and Dr. Duxbury has done a study indicating that the police service is showing a high number of the members who are killing themselves, committing suicide because of the tension that is within the environment, and the lack of support the members find themselves in after they have been exposed to a very stressful environment.
Now, given the South African context, we always talk about the violent nature that accompanies crime in South Africa. It almost seems extraordinary that we do not have a mandatory psychological debriefing in our South African Police Service at the moment. What's your view as SAPU on this?
We need to have a mandatory process where members must be debriefed after attending to horrific, incidents. But you see, the problem here is that members have to decide on their own to go to where these services are. At some stage, we as the union have to refer members to these services. And the police did not even have resources, to assist the members, let alone a vehicle for them to use to go to where the members are. A very disturbing situation.
It certainly is. I'll ask Brigadier Lenono about the resources or the lack thereof in a second. But I want to know from you, have you actually pulsed your members? Are they saying exactly why they don't feel the need to reach out and ask for help when they need it?
The command and control in the police and the way the professionals in this discipline behave, it is one of the things which makes members not to feel comfortable to go and seek this profession because of the way commanders, behave. And I think Brigadier will attest to this, that some of their challenges is that they have made to wear a uniform. And it is this uniform which members associate themselves with, and then decide not to go and seek assistance from them.
For those of us who are not au fait with, what exactly it is that the commanders or the command structure does, if you could just perhaps elucidate slightly on that?
The command and control environment I'm referring to, you have to toe the line. Yeah, sometimes the station commissioner wants work done through hook or crook. Whether you have you are showing signs that you need some assistance, and instead of commanders referring you to those professions, they want you to get into the van and go and service the people. That is what we call command and control. You must comply and complain it.
Brigadier Lenono?
Yes, there are some areas that I don't agree with Mr. Kwinika when he says that the services are not available and the support. What is currently happening is that we have made it mandatory that all our operational members, and especially those who are working in high-risk units, I'm talking about your POPs, your national intervention units, your crime scene management officers, they have to undergo debriefing at least twice a year. At least twice, that's a minimum. But also within that time frame, we're also offering a number of proactive interventions that look at your mental state, educating members about depression, about bipolar, about post-traumatic stress disorder. We have programs that look into substance abuse because we have found that substance abuse is also one of the factors that are really pushing our members into committing suicide. We have programs that focus on financial management, which is also one of the risk areas that we find our members in. And in addition to that, if I can bring in the commander story in, we have developed a program specifically for the commanders to say, commanders, if you do realize or if you become aware of these following symptoms, for example, if a member starts acting weird, if the member is withdrawn, if the member is absent most of the time, if the member is despondent, then refer the member for treatment. So we have those programs that target specifically commanders, because the commanders, they are in the front line. They know more what is happening with their members. So they are the main people who can refer the members to us. And also the unions, I think it's a joint effort between us as the employer as well as our labor representatives to say these are our members. We all care about our members. We want to see our members well. We don't want to see an increase in suicide cases. So it is also the responsibility of the unions to refer the members to us, and also the families, because our services are not only limited to our members. We know that our members do not exist in isolation. They are part of a system, whether be it a family system or a community system. They are part of that system, and you find that the things that happen in the family, they also affect them somehow. So we are saying, we are extending a helping hand to say, even if one of your family members need assistance, Employee Health and Wellness is there to assist the members. And with our members that are in remote areas where you find that it's very hard to reach them, there are also interventions put in place where we have partnered with our main medical aid, which is PolMed, that has the psychosocial network of providers that constitutes the private psychologists as well as the social workers who can reach our members in those far places where no one can reach.
When last did you assess the efficacy of these resources?
We do it constantly.
And what does your results show?
No, we do it constantly, and as I say, that what also Mr. Kwinika said is very important, that our members, they have to make that decision to access our services. Because when somebody comes for counseling, counseling is about a person changing their behavior. So if somebody is forced to come for counseling, behavior change, you won't see it that much. So the programs are there. We are reviewing them on a constant basis. We are developing new programs as well. And also we have an intervention called the organizational diagnosis. That is the intervention that we put in place where we realize that maybe in a specific area or in a specific section, there may be a lot of absenteeism, or maybe there may be commander-subordinate quarrels or challenges. Then we go in, we do the diagnosis so that we can help to build the team, because we have realized that work stressors as well as the relationships that you have where you are working may impact negatively on you as a person, and it might drive you to really resort to behavior that is really unwanted.
So I suggest the two of you try and find each other with regard to whether there are or are not adequate resources in place for police officers. But I want to turn to the community now and ask you, Mr. Kwinika, with regard to the community, is there more that the community can perhaps do? Because we know the perception out there of the police is that they are corrupt, and hence that comes along with quite a great deal of disrespect towards police officers. What can the community do to perhaps assist in this regard?
We think that the public professionals who are there, they may contribute by rendering these resources, which is so scarce in the police. And I think, Brigadier, you are reading the book. Most of the things which you were saying, they don't happen, And all those resources that you are mentioning are resources which are there. If we refer the members to the hospital or to the professions, yes, Parliament will pay. That is the book. But if we were to be open, you don't have resources. You don't have, and the fact that you also not give the facts, it tells you or your department that you are doing very little to address these issues of suicide.
And I'm going to give the Brigadier an opportunity to respond, and also perhaps just add to that, since the concern was raised in the Portfolio Committee earlier this year, what practical steps have been taken to implement measures to actually curb the rate of suicide amongst police officers?
As I have said, that we have seen that maybe what we are doing internally is not enough. Our main aim is for our members to get the help. So whether they get it internally or externally, as long as our members get help. That is why the POMET is augmenting our services, not to say that we do not have enough resources. We have psychologists, qualified social workers. We even have our chaplains as well as the occupational health nurses and occupational therapists that are there mainly to support the member. So the resources are there. However, we wanted to open it up because we know the stigma that comes with employees accessing employer services. Sometimes we become very reluctant to really utilize the services that the employer has made available for you. So we are saying to our members that if you feel that for some reason you don't feel comfortable accessing internal services, there are those external service providers that you can access where your employer does not have to know that you have consulted for counseling or whatever the case may be, as long as you do get the necessary help.
Brigadier, yes. I want you to respond directly to Mr. Kwinana's accusation, the allegation that he makes that you, as a top brass, you're looking at the book, you are going by what you are told as per the book should exist, should be done, and should be catered for. But in fact, the reality is that these things are not happening practically on the ground. How do you counter that narrative?
I'm not sure where Mr. Kwinika is really getting that information, because he knows very well. He knows there's no one who does not know about employee health and wellness. The only challenge that we are experiencing is for our members to come forward and say, I need help. Because we are still working in an organization that is pretty much still macho, where there's that notion that tigers don't cry mentality still, that we are fighting against. And that is where we actually need them, the people like Mr. Kwinika, to tell their members, to say there is employee health and wellness services, go and seek help. So it's a partnership that we really have to foster. It should not be them against us. We are all for the member. It's only one member. So we need their assistance as well as the unions to refer their members to us. The services are there and our members are very professional.
Just a final word, Mr. Kwinika. You heard what the Brigadier has to say. From your part as a workers' union, how do we move this forward?
No, we can't. That's not our job to refer members to their services. They must market that department very well. And then people will come in and assist. The public will come in and assist. The union will come in and assist. But how do the people come in and assist you when you are not there? You are not visible. And the issue of us not knowing that there is psychological, spiritual, and even social workers, we know that. We don't see them. They are not there. You said it on air. You said you are trying to reach out to those units, which are like public order policing, at least twice in a year. No, not twice. They must always be there. They must always be there.
Thank you so much to both our guests this morning, Mpho Kwinika, who is president of the South African Police Union, and Brigadier Petunia Lenono from the South African Police Services. And as you can hear, there is, of course, some water that needs to be traversed from both sides so that they can find one another in order to help the police members on the ground, and perhaps from our side as a community also try not to exacerbate the problem faced by police officers on a daily basis. Let's take a break, and on the other side of that, we'll have the latest news.